Hello, and welcome to Science of Dentistry. My name is Dr. Jamie Azdair, and sitting to my right is Dr. Azdair. Today we're going to talk about how Dr. Azdair began his dental journey.
Okay, my name is Dr. Azdair, and I graduated from the USC School of Dentistry in 1978. And up between the 1920s, up until probably 1980, USC was known to be one of the most famous restorative schools in the world for what they have accomplished over 60 to 70 years. And basically that was gold restorative dentistry, and it was gold filling restoration work, and they were very concerned about the body and how the materials affected the body. And I picked USC because of that program. And then when I was in school, as a child, I worked a lot with automobiles and energy. And when I got to dental school, I was thinking about how putting different materials in the mouth, how it's going to affect the energy of the body. When I got out of school, there was a group called Gnathology, Gnathology. And these were men that made USC famous on the word occlusion, which is the biological part of how you masticate the teeth, how they come together. And they tied it into the skeletal part of the body, to the cranial osteopathy part of the body, and to the sacrum part of the body. This group, there was only 1% of all the dentists that did this type of work, because to do this type of work, they would spend 100 to 500 hours on maybe 10 teeth or 15 teeth, reprogramming the TMJ, the temporomandibular joint, or the jaw, and they became famous because of this. This group was basically looked down upon because they were rebels, and they took dentistry way beyond what one could imagine on an engineering level. So I studied with a couple of these men, and then I'm 74 next month in August, and they were my age, or 74 to 90 to 95. And that whole group, when I graduated, was accessible for me to study under, because they were willing to give their knowledge to somebody. But when they were younger, they wouldn't do this because they were competing with the rest of the universities in the world. Once I started getting ethology, I was with a famous dentist who was named Dr. Everett Payne. And I studied with him in Beverly Hills, but I worked in almost 100 to 200 offices. And when I was in these offices, I was taking health histories and noticing that how the materials affect the health of the body. And then I started practicing on clinical research and doing all this in my own office and covering areas of applied kinesiology, pendulums, energy, designing materials on molecular levels, cross-referencing materials homeopathically. And what I've noticed over the years is their medical symptoms, when you focus on toxicity and keeping the teeth alive, that 70% of their symptoms usually change in their health.
Wow.
And doing this, it's very costly because there's a lot of time into it. Like I said, a few hundred hours. So the reason I've never surfaced in 48 years that brought this up is because now I'm surfacing because we have a 45-foot MCI coach, and we're going to put our science, which is USC science, classical USC work, into the coach, and then we're going to hit the poor areas, and we're going to look for the sickest kids, and we're going to heal them through the teeth with the traditional USC restorative.
Right on. And our nonprofit's name is the Gnathological Research Institute of CAIC, and we're doing business as CAIC. CAIC stands for Christ Am I Confused, and that name came from his mentors when they pioneered the study club back in the 20th century.
Because they really didn't have an idea where they were going, and they were always there. They had no idea. And most of all the other dental schools in the world, except for Northwestern, because Northwestern, they had a founder named G.V. Black, and he was the founder of clinical restorative preparation design and worshiping enamel.
So, Papa, where did it all begin?
Okay.
How did your dental journey begin?
Yeah. Well, I was probably 9 years old to 13 years old, and we had no money, my family. I worked on my grandfather's trash truck on the weekends, and we had 2 dental offices in Pasadena. And those dental offices are only 2 or 3 blocks from where this Pasadena media is. And one was a famous dentist of USC, and his name was Dr. David Shushan.
And how many blocks away from here?
Probably 3 or 4 blocks, 5 blocks from here, up by Walnut. And he was famous, and we would go to his office to take the trash. And I was 13 years old looking at the study models, and I was mesmerized by just looking at them for some reason. And then when I was there was another dental office about 5 blocks from here, and we took that trash, and that was all marble, black iron work, old equipment. It was just, I was amazed by what I used to see.
What were you looking at in Dr. Shushan's cabinet?
The perfection of just what I saw, like what I learned to do when people go, wow, when they look at it.
Did he have articulators in there?
He had articulators. He had mounted models. He had gold filling restorations. One lab was just for waxing. One lab was just stone because he didn't want to mix the powder into the wax, which nobody thinks about that. Okay. And
which we're going to be talking about in future episodes.
Dr. Shushan was famous, and he was world-renowned, but he would recommend anybody to dental school.
Right.
So when I was about 16, 17, he told me to sit by the desk one day, and I was nervous, and he says, do you know what you want to be? And I said, no. And then he said, I thought you were going to be a dentist. And I said, but I have like a 1.9 GPA from high school because I was going for Junior Olympics in swimming and water polo. And he said, that doesn't matter because I was a C student. So basically, I was gifted by God that he recommended me to USC. And when I applied to dental school, I only picked 2 schools. Not that I'm a genius, because I really wanted to go to SC. And on my interview, when they said, what would happen if we didn't take you? I said, well, I'll do whatever you want. Just tell me that I go through college again or whatever it is.
What was it about USC that you were so geared on?
The gold restorative dentistry, because I saw that in Dr. Shushan's office.
And Dr. Shushan was teaching at USC?
Teaching at USC, world-renowned. Back in 1960s, he would have 2 dentists come to Pasadena to his office on a Saturday. In the morning, he teaches gold inlay preparation. Morris, the technician, waxes it up while they go to lunch. The afternoon, he cements it, and it was $2,500 each doctor in 1960s.
Wow, Morris waxed up, invested, and casted, finished
while they were at lunch, and then reseated, and that was the whole course.
Wow.
Yeah.
Wow, cool. So where'd you go to college?
My college education was Pasadena City College, and this is for this is for all the people that are going to college that when they tell the counselor what they want to do, and he says you can't do it because you're not smart enough.
Right on.
So I went there and I told him I wanted to be a dentist, and he says, no, you don't have the grades. And I said, what do I have to do? So he put me in remedial.
In PCC.
Yeah. And then I went through PCC, and then I went to San Diego State, came out with 3 degrees with like a 3.8 average, and then I went to USC Dental School.
Because Shushan recommended you.
Yeah.
And where else did you apply?
Loma Linda. But I went to Loma Linda, and the guy said, why are you applying to Loma Linda? I said, because I'm not a Seventh-day Adventist, so maybe you'll take me. And then
what were you wearing at the Loma Linda interview?
I had an all-white mod suit, large lapels with a Hawaiian shirt for my interview.
With no tie on.
With no tie.
Okay, so USC accepted you.
Yeah.
And you want to talk about like where you were when you got the acceptance for USC, or you want to just jump straight into USC talking about that? Where were you when you found out you were accepted to USC?
Okay. I was up at Lake Arrowhead for the summer, and water skiing, I competition race ski up there. And I was at Arrowhead for 3 months, taking the summer off. And then somebody called up. I had a single apartment in Manhattan Beach, and somebody said that I had mail. And they called up like August 20th. But the mail said I had an interview on July 30th. So I missed my interview.
Mm.
And then I freaked out. So then I called the school, and luckily I was right before the interview of all the students were the first thing. So they put me in that. But I could have missed out on that.
What was dental school like?
Dental school, back in the time when I went to dental school was SC was the most difficult school of all the schools to go through. It was 8 hours of lecture, 6 to 7 hours of lab at night, and then you got to figure out how you're going to study. And it was mostly all hand work. And they were known as hand gods because they perfected the cavity preparation. Everything they did was like the top of the world.
They meaning like the students and professors?
No, just the students.
The students were known as hand gods.
Yeah.
That's cool, because when I went to dental school, the students who were good at the handwork was known as hand gods as well.
Yeah. And we were known as Figueroa Tech, and UCLA was known as Research.
See, that's so funny, because when I went to school there, we called ourselves the Figueroa Tech School of Bondodontology.
Yeah.
But we were Fig Tech, you know?
Yeah, dentists today are not really dentists. They're bondodontists.
Yeah.
They're no different than the girls that do the acrylic fingernails. And the reason why the women of today of cosmetic dentistry make better dentists is because they're more into the shades and the hues and the shapes. And they would do that better than men. But still, the problem is the modern materials today.
Yeah, it's a huge problem that we're going to be talking a lot about in this show.
Mm-hmm.
But back into dental school, how many people graduated from dental school that started? Was there like everyone passed type of thing?
No, we had a couple suicides, and maybe out of 120 students, probably 2 would drop out, and maybe 1 tried to commit suicide, and that would probably be. And then maybe 1 or 2 was put behind.
Because the pressure was so great.
The pressure, yeah. But UCLA didn't have that pressure. It was totally chill. UCLA was pass or fail.
Wow.
It wasn't grades. CC was grades.
See, today it was known that USC produces the clinicians that can graduate and do well with their hands, and people from UCLA would go into like research or specialty.
Yeah.
But like we made a grad residency program in order to bring dentists up to speed when they graduate if their hand skills didn't feel that comfortable.
Well, that's funny you say that, because the dean of USC, when I came across from him and I met him, the dean that came up the last 10 or 15 years, I asked him if we could teach the gold work. And he got rid of all the gold restorative dentistry because he wanted nothing to do with it, because he wanted to bring implants in because that's where the money was. And when I showed him all my work, he basically said, Dr. Azdair, we don't need good hands anymore. Our students don't need to have good hands. So it's funny how you're telling me that you guys were known as good hands.
Not all of us, only the ones who excelled and were known to have good hands.
And what's the percentage of the class of that?
Like 5%, 3%. Maybe some people called themselves hand gods, but like you're only a hand god if you're like really good at what you do in that procedure. And like some people were like lab gods, or some people were like crown gods or denture gods. It was more like specific to the procedure that you're talking about.
Yeah, well, they should have been more like devil technicians or whatever, but it didn't have to explain that handwork at USC is the preparations had to be basically prepped with lower speed instruments and all hand instruments, like you plane wood, you carve wood in dental school. Okay. So the preparations look like perfect 3-dimensional line angle bevel work, and they had to be perfect.
What were the units in your dental school?
How many units of what?
What was the unit you were using in dental school?
A unit?
Yeah, your dental unit. on the clinic floor
Yeah.
in dental school, what was the dental unit name that you were using?
Oh, the Ritters.
It was the Ritters.
Yeah.
So was there a cable slow speed or was it air slow speed?
We had cable, and then in my second year, they went to air.
So you transitioned from cable to air with a slow speed to refine your preparation?
Yeah, this is also on the dental unit he's talking about. There's a big cable on the older ones. And the reason why they had that was because they didn't have high-speed handpieces up until the 50s. So the dentists weren't really that aggressive of mutilating teeth. It was too hard to cut a crown, so they worshipped enamel. Today, your handpieces are 400,000 revolutions, and they can remove all the enamel off the tooth in 90 seconds.
You can blow through the whole tooth.
Yeah.
But so what was the high-speed handpiece being used for in your dental school?
For preparations of cavities and preparations of the teeth for crowns and restoratives.
So, but then after accessing the cavity, you would then switch to slow speed for excavation and for preparation refinement?
Yes.
Oh.
He's talking,
Yeah.
He's talking about, which they don't do anymore, when they used to, first they opened up the tooth with a high-speed handpiece, minimal, and then they have the slow speeds like on the cable, but they use steel round burrs, and the steel round burrs will remove the decay, but they don't cut the tooth, so you could save the life of the tooth. Today, nobody does this. They just take high-speed carbide burrs, and then they just want to go. They're no different than the Streptococcus bacteria, because the Streptococcus wants to eat your enamel and go right to the pulp, because that's the filet mignon of the tooth. So the dentist is doing the same thing. He's drilling the tooth, and he's thinking, if he hits the pulp, now this is going to be root canal, post, and crown, and that's more money than a filling.
And when you say they today, we're talking about practitioners in private practice.
Yes.
Because in dental school, we were taught almost the same as you in terms of preservation of tooth structure.
Yes.
When removing that. Because I found that too. When I graduated from dental school, I got into private practice. I'd ask for a slow speed handpiece, and I'd be fancy for asking for that. Sometimes we get high speed diamonds too. But that's only in like the nicey offices.
Have you ever experienced, since you've been out of school, have you ever experienced working in a dental office and they want you to root canal all the teeth so they don't want sensitivity from patients?
Almost all the offices I've worked in have never told me go root canal that healthy pulp. One of the first offices I was in had it planned for a root canal, and I pulp tested it, and the tooth was vital. It was a healthy nerve, and the caries excavation on the buccal side of the upper right canine went not far enough into the pulp. I cleaned it all out, and there was still healthy dent in there. So the owner of the practice was there. I'd get up to them and ask him, hey, you planned a root canal, but the pulp tested vital, the caries is excavated, and I'm nowhere near the pulp chamber. Can I just do a filling? And they said, yeah, that was fine. But you always get like a little bit of like pushback in indirect ways following that, knowing you didn't do the right thing in that moment there. But that was like the closest it ever got to them saying, go root canal that healthy pulp. Because I claim to be a nathologist wherever I work.
Yeah.
And I explain that. Even, I won't talk about that.
Do they let you base the teeth up?
Well, no, because in dental school, we were taught when you clean the cavity out, you place a resin primer and then a resin adhesive directly into the dentin to create these dentin plugs to create more retention, micro retention for your bonded restoration into the dentin. It wasn't until after I graduated from dental school that I was working in your office and realized how important it is to respect the health of the pulp. And by doing that, Papa was referencing just now, placing a cement restoration first that creates like a concrete block, blocking the pulp from the restoration that is inherently toxic because we're using composite.
So basically, they want you to. It
takes too much time in private practice to have 2 appointments when the insurance only pays for 1 restoration.
Well, then you should do insurance work.
Well, that's a whole other topic for another episode, right? Did you do dentures in dental school?
Yeah. Yeah, I like dentures. I did a lot of.
Yeah, I like dentures too.
I really like dentures. Yeah, and in dental school at SC, I had time I made dentures for your great grandfather and my grandfather.
Good story.
And On the dentures, I put gold occlusals, which means the bite was done in gold.
Because you had a denture tooth.
On a denture tooth.
And you prepped a gold filling.
Restoration.
And then casted that gold restoration, cemented it onto the denture.
Yeah. So I was pretty radical in dental school because I really didn't associate with the instructors, but I was like a rebel. So I made
the old guys.
I made, except for the old guys, yeah. But I made the dentures, and I was in the removable prosthetic department because there's different departments: operative, removable, perio, endo. I was in the removable section to get my dentures graded and checked off. And the instructor came over, took a mouth mirror, looked in the mouth, and then he came out and said, "Can I talk to you?" And I said, "What about?" He said, "You're in the wrong department." I go, "What do you mean in the wrong department?" He says, this is removable and this is, you have operative. And I said, "No, those are dentures." And then he went back and looked, and then he realized that they were dentures.
He thought they looked like real teeth because he saw gold on the denture.
Yeah, when he took his mouth mirror and the tissues all looked like acrylic, I picked the right shape, so everything looked like a real mouth.
And just to clarify here, there's different departments on the clinic floor, and those departments are split up between what kind of procedure you're doing. So in the removable department, we work with dentures, removable prostheses, whether they're complete or partial. Operative would be where you have your tooth operated on and then restored. So operative restorative is another department. Yeah,
that was my experience.
Did you have a perio department in dental school?
Yeah, we had periodontal. Mm-hmm.
So
they wouldn't let me I had to be held back one semester.
Because of perio?
No, in dental school.
Oh, yeah?
They held me back because they wouldn't graduate me.
Is that because of the class 5 gold foils?
Yep.
What's a gold foil?
Okay. A gold foil restoration, USC is known for this, and maybe Northwestern might be known for this, and Loma Linda might be known for this, but gold foil restoration is by the gum on the outside of your tooth. If you have decay, they'll prep the tooth. It looks like a little triangular prep, and then they hand condense gold foil. So when you're done with the procedure, it looks like it's cast gold. That's finish. You don't cast it. You directly mallet it, and that's a gold foil. Now, this gold foil...
So it's like a direct filling.
Yeah, but
the final product would be solid gold because the gold gets annealed
by putting pressure and heat.
And heat.
Okay, so this is the hardest restoration to do. SC was known for it. California had the top dentist of the world. 65% were SC graduates. And then the foreign people came along, and they couldn't. Now, in other parts of the world, I don't think they go 4 years to college and then they go to dental or medical school.
It depends on the country.
Okay.
Yeah.
But when they came over here for licenses, they would go to USC and take all the courses, like for a year, because they were dentists, but they could not pass the gold foil because that takes a lot of discipline. And discipline, once again, is something that you don't want to do, but you got to do it. And it takes hundreds of hours to master this technique. And this was on the state boards of our California license. So they sued the state board of California because they said it was too hard, and they substituted the gold foil for cleaning one quadrant, which means there's no way to check a cleaning unless they cut the gums up.
Yeah, the criteria is more relaxed.
Yeah. So California dentistry is no different than anywhere else in the world. And a lot of people are going to Mexico, but it's not smart because if there's a problem, they can't sue anybody. But they're all going to Mexico because the dentistry from the west side of town to the Mexico, it's the same materials and the same guys, they mutilating teeth, and they all do the same procedure.
No different than the strep mutans bacteria.
Yeah, exactly. Because the pulp is the filet mignon for the bacteria, and he's digging into that, trying to get to that blood for nourishment, and the dentist is doing it for money.
Right.
So today, dentistry is all geared up about money, not about the profession. And modern dentistry really has nothing to do with health, and they don't say it has anything to do with health. But people think that they're getting healthy dentistry.
I can't wait for a future episode when we talk about what holistic dentistry means. That's a whole other episode.
So when I mentored under these guys, I had like probably 25, 24 men, 70 and 90 years old. I would do dentistry all day, go to their houses at night and drink Mexican coffee, stay up till 1, sleep 3 hours, go back to another office. And they all taught me the truth of all different aspects of dentistry. And
Because you like apprenticed under several different like master dentists.
but I
and
was
had
at
to study
but
it.
I was at the right time because they were all that same age. If I would have graduated and they were like 50 years old, you're not going to get that kind of knowledge because they're
They got
older.
lives.
Now they want to give it to somebody.
Right.
Yeah.
Wow. Well,
But they also said, if you go this route, you'll have a good lifestyle, but you'll never make a lot of money. Even though these cases could be 100,000, 200,000, 300,000, but you're talking like $500 an hour. And today's dentistry, you can get full mouth implants from in 2 or 3 visits or 1 visit for 35,000 to 75,000 an arch. And then that's where dentistry is going right now.
and when we talk about our dentistry in your office being 100 to 200 hours minimum, we're talking chair time, patients in the chair over many appointments to accomplish having spent 200 hours together to do the restoration.
And at USC, it used to take this type of work. And before anybody would come in for gold restoration work, they would be counseled by a counselor, letting them know about how long this is and how much time it takes. But then once you start doing this type of dentistry on a patient, you see them once a week. And then if you cancel them, they get mad at you because each time they leave, they feel better and better and better.
Especially in the encounter itself, our patients leave feeling better than they did when they walked in the door.
Yes. And that goes back to the science of dentistry.
Cool. Well, then that's it for this episode of Science of Dentistry. Again, my name is Dr. Jamie Azdair. Sitting to my right is my father, Dr. Azdair. We just wanted to explain a couple things. If anybody is interested in what we're talking about, or as the episodes come on, they get intrigued or want to come and talk to us, we have an office. Our address is 330 North Garfield Avenue, suite number 4, in the city of Alhambra, California, and the zip code is 91801. So we also have a phone number. Our office phone number is 626-282-3648. Again, that is 626-282-3648. We won't charge anybody if they just have a question. We sometimes talk with people for 10, 15, 30 minutes on the phone. We love answering questions. If you have any questions and you want us to address them on these shows, please call us or write to us, and we'll be happy to address those questions as we come on. The other thing, too, is we wanted to invite any guests, if there are any other health practitioners, dentists, osteopaths, acupuncturists, anybody who's interested in what we ever have to say about and want to come on and debate us about it. We warmly and encouragingly welcome anybody to come and have debate with us. I used to do debate in high school, and it's a fun way to get ideas across. We also have an email address. It's meddent4@gmail.com. So that's spelled MEDDENT 4, the number 4, at gmail.com. That's it for today. Do you have anything else you want to add?
Mm-hmm.
All right. Thank you. And we'll see you again shortly.